Hey guys, how are you all? Welcome back to MedSteps YouTube channel. So today in this video we are discussing about, we already started one series, that is first aid series in musculoskeletal system. So today we are in episode 4. So our main topic is brachial plexus and brachial plexus lesions and some nerve supply of the arm. Okay, so in this video we will discuss little anatomy, and step by step we will go with some images, and I will try to explain some basic things from first aid guide. Okay, so let's go. What is brachial plexus? In mostly, brachial plexus means we have to think that nerves is that it's a one of the network of nerves. Brachial plexus means network of nerves that arises from the spinal cord. Okay, it's nothing, it's easy. It's a like network of nerves that are arising from spinal cord, in which level C5 to T1, and it supplies the hand, total arm. Okay, so if you are seeing this image, you can see here, this is the spinal cord, cervical spinal cord. In this cervical spinal cord you can see some nerves are coming out, some nerves are arising outside. So C5, C6, C7, C8, T1, these 5 nerves can cause this these 5 nerves we call brachial plexus. Okay, and next, what's the main function of this brachial plexus means? First one, motor function. Innervation. In motor innervation and sensory innervation, okay, where these nerves are passing, that is impulses, innervation and motor function, everything means like muscles of shoulder, arm, forearm and hand. Okay, if you okay, for brachial plexus we have to imagine like this is one of the highway. In highway, how that route maps, that roads and everything will be like interchange. Okay, same to same like that, here also this nerves act like a highway and interchange, where that nerves fibers will mix and it switch and branch, and finally we will get some branch to reach different destination. So different destination means different, like in shoulder we have some many types of muscles. So based on this, now that nerves will like innervates like motor function and the sensory innervation, we can see like different based on different muscles. Okay, now for brachial plexus we have one mnemonic. This mnemonic is very important. You can easily remember. The mnemonic is Randy, Travis, drink cold beer. Okay, now Randy means it's roots, Travis means trunks, drink means divisions, cold means cords, beer means branches. Okay, so this is the mnemonic for brachial plexus: Randy, Travis, drink, cold beer, roots, trunks, divisions, cord and branches. Okay, so here now we will discuss step by step. First of all, we can, after that's from the spinal cord arising that plexus, first we will see the trunk, roots. Okay, in these roots mostly you can see 5 roots, and mostly from where this roots are coming arising means C5 to T1, that means C5, C6, C7, C8, T1. Okay, next one, trunks. How many trunks we can see? Total 3 trunks. Okay, so these 3 trunks we can divide into three parts, like C5 to C6 will form one trunk, and C7 will form one trunk, C8 and T1 will form one trunk. So total 3 trunks. Next one, divisions. In divisions, each trunk, that means 3 trunks, right? This each trunk split into anterior and posterior. Split into anterior and posterior. So how many divisions you will get? Okay, here 3 trunks. 3 trunks is divided into, okay, so you will get total 6 divisions. Okay, now so in divisions, then after we can see some chords. How many chords we can see? Total 3 chords. The 3 chords like lateral, posterior, medial. Okay, next after these things we can see branches. How many branches you can see? Total 5 terminal branches. So this is the main nerves, final branches, that is like axillary nerve, musculocutaneous nerve, radial nerve, median nerve, ulnar nerve. Okay, axillary nerve, musculocutaneous nerve, radial nerve, medial nerve, ulnar nerve. Okay, so here first the brachial plexus come by like trunk, roots, then after trunks, then after divisions, then after chords, then finally we can see branches. Here totally the branches you can call, that is axillary nerve, musculocutaneous nerve, radial nerve, median nerve, and ulnar nerve. Okay, so here this we can see some these branches and everything. We can say like between to neck and armpit and supraclavicular plus infraclavicular regions, we can see this type of this chords and chords, divisions and everything. Okay, so first imagine these roots come out of spinal cord. Okay, like C5, C6, C7, C8 and T1. Then after it merge to form trunks. How many trunks we saw? 3 trunks. Okay, like these 3 trunks we can see like C5 to C6, then after C7 and C8 and T1. Each trunk splits into divisions like anterior and posterior. Total we will get 6 divisions. Then the divisions regroup into chords, and it's like around like axillary, artery and these things. The chords give off branches that we call, that is terminal nerves to the limb. Okay, that like axillary, musculocutaneous and radial, medial, ulnar. So now this now we are going to see the location and landmarks of these trunks and divisions and everything. Okay, landmarks. In landmarks, first of all, we can check roots and trunks. These roots and trunks we can see in neck. Divisions we can see behind this clavicle, and chords and branches we can see in the axilla or armpit. Okay, now mostly for sensory zones, if any axillary nerve will pass, we can see that axillary nerve sensation in over deltoid muscle, that radial back of the hand or thumb side. In median, that median nerve palm plus lateral third of fingers. In ulnar, medial and one of fingers like palmar and dorsal. Okay, and these things everything I discussed already in episode 3. So you can, if you don't know, you can see that video first, then after you can see this, you can watch this video, because if you don't know that basic things, then you will get a little confusion with this brachial plexus and these things. Okay, next, so this mostly axillary nerve. This axillary nerve main function is helping for shoulder abduction because that it's innervating to deltoid muscle, and we can see, and it will innervates to teres minor, and so sensation of deltoid and everything. Musculocutaneous, mostly we can see flexion of the elbow flexion, because it's innervating to biceps and brachialis, and like anterior arm muscles. That radial nerve, you can see the elbow extension and wrist extension and fingers extension. You can see dorsal sensation. And if you are seeing median nerve mostly help for forearm pronation and wrist flexion and thumb opposition. And ulnar nerve will help for finger abduction and adduction, finger movements like intrinsic hand muscles. Okay, so next, so based on this, we have some additional branches like roots, trunks and cords. Okay, so here when it's coming to roots, some in C5, that's dorsal scapular nerve will innervates the rhomboids. Long thoracic nerve like C5 to C7, we can see it's innervating to serratus anterior. Okay, like that we have this nerves. These nerves will innervate some muscles in our shoulder and forearm and hand. This is brachial plexus. In this brachial plexus, I already mentioned this nerves coming from C5, C6, C7, C8, T1, and first we have roots. After roots we saw the trunks, then after trunks divisions, cords and branches. Okay, so how many trunks we have? Total 5 trunks, total 5 roots we have, then after 3 trunks, then after 6 divisions, then after 3 cords, then after total 5 branches. Okay, if any problem happened in this total this roots, trunks and division, cords and branches, then we can see some brachial plexus lesions. Because of that we will get some Erb's palsy or Vater's tip or Klimt's palsy, claw hand, and wrist drop, winged scapula and deltoid paralysis, Saturday night palsy, and difficulty with flexion elbow and variable, this everything, the intrinsic muscles problems, everything we will get. Okay, so step by step we are going to discuss each pathological conditions in brachial plexus lesions. Okay, so first of all we are going to see the Erb's Vater's tip. In Erb's Vater's tip, where we can see the injury, mostly the traction or stretching of a tear of the upper trunk. In upper trunk, mostly C5 to C6 root. Okay, C5 to C6 root. If any patient got this traction, then that patient will, in that patient we can see the Erb's palsy or Vater's tip. In causes, mostly first in infants, during delivery or lateral traction, when baby is that baby is getting delivery, that time, that because of that neck traction, that patient can get this C5 C6 traction, then it can cause Erb's palsy. In adults, if any patient got any trauma, then we can see this Erb's palsy. Okay, in presentation, loss of function of supraspinatus and deltoid muscle. If any patient got supraspinatus and deltoid muscle, that patient will get either we can't see any abduction. Okay, so the arms hangs by side, and infraspinatus, that lateral rotation, arm medially rotated, and biceps brachii and flexion of supination, arm extended and pronated. If you are seeing this image here, you can see this brachial plexus is get stretched due to traction. Okay, and here if you are seeing this baby, that arm medially rotated and elbow extended and forearm pronated and wrist flexed. So when if you are seeing adult, mostly we can see this type of image. That's why we call this is Vater's tip hand. Okay, next we are going to see the clumky palsy. In this clumky palsy, mostly we can see this injury or traction of lower trunk in C8 to T1. If any patient got this type of injury or traction, then mostly we have to think this is claw hand. Okay, this clumky palsy are also called claw hand. Okay, here where we have this traction C8 to T1 causes. In infants we can see upward force of arm during delivery. So in infants, if arm pull during birth, that time that patient will get this clumky palsy. And in adults, mostly we can see grab branch to break fall. That means any trauma, like anyone grabbing a tree branch, a break, a fall. For example, this image. If you are seeing this image, this adult, what is doing is grabbing a tree to break a fall. Okay, then he holding that like that, then that patient will get this type of claw hand. Okay, this, if you are seeing this image, this delivery image, you can see that someone arm, someone like if they are pulling that, if that hand came out, then that doctors are pulling that hand unknowingly, then the arm pull during that birth, then it can cause this claw hand. Okay, so the lower trunk of bilateral plexus carries nerve fibers like C8 and these things I already mentioned. So that time, that because of that traction, that median and ulnar nerve can get paralysis, and some innervates all the intrinsic muscles of the hand, and that like hand clumsiness or paralysis. Okay, so because of this claw hand, mostly we can see loss of function of intrinsic hand muscles like lubricals like 1 and 2, and introitiate, thinner and hypothinner muscles. Totally we can see total claw hand. This is the image look like. This is image we can see here and here. This is the claw hand. Next pathological condition is thoracic outlet syndrome. This thoracic outlet syndrome, also known as TOS, is the space above the first rib and behind the clavicle that is bordered by the cervical vertebral bones of the sternum. Here what will happen? Okay, in neck region we have some muscle we call that is scalene muscles. Okay, or scalene triangle, which is found by the anterior and middle scalene muscles of the first rib. If any patient, okay, for example, first see this image, based on that you can understand easily. So this is the cervical region. In cervical region you can say this is the muscles, we call this is the scalene muscles. If the scalene muscles have hypertrophy, that means increasing size. Okay, and because if any tumor coming any tumor getting here, then it will compress that nerves. When that compression of lower trunk or subclavian vessels or cervical rib, or maybe because of some tumor, it can cause this thoracic outlet syndrome. Because of that compression, we will get that this thoracic outlet syndrome. Okay, this is the anterior scalene muscle, this is the middle scalene muscle, and here this is the posterior scalene muscle. That nerves, that brachial plexus coming from in between that muscles. When if any muscle got like hypertrophy, that increasing size or wide, then or any tumor, mostly here one will get one tumor, that is that tumor we called Pancoast tumor. If any patient have that type of tumor, then it can cause this thoracic outlet syndrome. Okay, and because of the thing, this blood vessels, the subclavian vessels also will get compression. Okay, now mostly in injury we can see compression of lower trunk, we already mentioned this thing. Okay, in causes, we like that compression of lower trunk will happen. Presentation, in signs we can see like some same claw hand, like ischemia and swellings and pain. Okay, first of all we have to get tension, we have to, this is like life threatening condition, first aid alert, that if any patient getting arm swelling or weak pulses, then we have to urgently referral for vascular compression. Okay, because of that compression, we can see that subclavian vein and subclavian artery will get because of that arteries and veins compression, it can leads to swelling, stinging sensation, weakness, extremities of numbness. This everything we can see in thoracic outlet syndrome. Okay, next one, wing scapula. In wing scapula, that where we can see the lesion long thoracic nerve and roots like C1, C5 to C7. Okay, and it's mostly this wing this nerve is innervating to serratus anterior muscle. Mostly we can see it's that origins from surface of first 8 ribs, we can see this thing, and insertion will be the medial border of the scapula. If you are seeing this image, this is the insertion of the medial border of the scapula, and origin will be from upper C8 upper 8 or 9 ribs. So these are the serratus anterior muscles. Okay, here why this wing scapula will happen? If any lesions in long thoracic nerve like C5 to C7, or if patient got any like mastectomy, surgical mastectomy or stab wounds, then that patient will get wing scapula. Okay, here this function because this nerve stabilize and rotate the scapula upward. Okay, whenever this lesion happen in this long thoracic nerve, that scapula will not go upward and it will forms like winged. Okay, so that's why. So I already mentioned the patient, if any patient got axillary lymph node dissection or radial mastectomy or chest tube insertion or some stab wound, it will cause wing scapula. So what are the signs we can see? In signs we can see the scapula. If you are seeing this image, the scapula protrudes from back when pushing the wall. Okay, when you are trying to push the wall, that time the scapula will protrudes back. Okay, in first aid, like we have to support the shoulder and we have to refer for nerve injury. Okay, and patients will also show some weakness in abducting the arm above horizontal due to impaired rotation of the scapula. Okay, so these are the things we can see in brachial plexus and brachial plexus lesions. So in this video we discussed about Erb's palsy and Klumpke's palsy or claw hand, and thoracic outlet syndrome and some wing scapula, and we discussed about brachial plexus. If you have any doubt, you can ask me in comment section. Okay, if you till now if you didn't subscribe my channel, like, share and subscribe. We will meet in our next first aid episode 5. Take care, bye bye.